Hello, everyone. This is Dr. Ahmad, and today we are going to start the renal system. And in the first instance, we are going to start with the renal anatomy. So, by the end of this presentation, our objectives is to learn today about the surface anatomy of the kidneys and ureters, the renal capsule, blood supply and the surface relation of the kidneys, segments of the kidneys, external and internal features of the kidneys, ureters, its constrictions and their significance in renal stones, and finally we're going to learn about the suprarenal or adrenal glands, its anatomy including the blood supply. So let's start with the surface anatomy of the kidneys. So kidneys are the paired organs that are present on the posterior or at the posterior body wall. They are present on the either side of the lumbar vertebrae on the paravertebral gutter, meaning it is not in the mesentery. So what is the paravertebral gutter? It is the space that is immediately lateral to the vertebral column, specifically the lumbar vertebrae, and occupying both kidneys and the adrenal or suprarenal glands. What is the exact location? Where are the kidneys present? So they are located between the transverse processes of the T12 thoracic lumbar body, between the transverse processes of the T12 to L3 vertebrae, and it is also located between the rib 11 and 12 posteriorly on both sides. One thing that you have to remember is that the right kidney is pushed down a little bit in comparison to the left kidney because of the liver. The liver is pushing down the right kidney a little bit down. The adrenal glands are present at the superior medial aspects of both kidneys, and both kidneys are surrounded by the renal capsule and the fat. So let's look at this diagram right here. So you will see that this is you're looking on the posterior surface. So the spine is right in front of you. You see that this is the lumbar spine or the spine right here. This is the T11 and it's going down all the way. This is the left kidney is going to be right here, and this is the right kidney. You see the liver pushing down the right kidney a little bit lower than the left one. You'd also see the some of the relations with the other organs around it in the abdominal cavity. You see the spleen right here on top of the left kidney. You also see the tail of the pancreas right there. You also see its relation of the left kidney with the descending colon. On the right kidney, you see the right adrenal gland on the top. You'll see the ascending colon right here and the head of the pancreas attaching itself or in relation with the right kidney, and you also see both ureters going down uh, going down to the urinary bladder. So what is the renal capsule? That is the second aspect that we are going to learn today. It is covering both kidneys with the perinephric fat, and it is continuous with the renal sinus. The renal fascia surrounds the perinephric fat, and the purpose of the renal capsule is to hold and support and maintain the position of the kidneys in the abdominal cavity. So now we're going to look at the blood supply and the surface relation of both kidneys. So both kidneys are supplied by the renal arteries. They are originating directly from the aorta. Both renal arteries originate at the level of L1 and L2. It is important to remember that. Aorta is present in the midline, so the inferior vena cava is going to be anterior to the aorta. Now this is essential because you're going to see the differences in the length of each vasculature, both arteries and the kidney and the veins that is supplying both kidneys. The superior mesenteric artery is superior to the renal arteries, that is bifurcating, that is originating from the aorta itself, while the inferior mesenteric artery is inferior to the renal vasculature. Now, if you remember, I just told you that aorta is present in the midline. However, the inferior vena cava is further anterior to the aorta itself. That translates into right renal artery, which is going to be longer, and the left renal vein, which is going to be longer. Conversely, the right renal vein is going to be shorter, and the left renal artery is going to be shorter. So you just have to remember, or just remember the placement of the inferior vena cava in front of the aorta. So let's look at this diagram. This is the abdominal aorta. This is right here is the inferior vena cava. So this is the right kidney. This is the left kidney. So now you see that you're looking from the anterior aspect. So you see the right renal vein is shorter because it is anterior to the aorta, but on the posterior of this inferior vena cava, this is the right renal artery. So right renal artery is longer because it's traveling from here all the way there. But when you look at the left kidney, the left renal vein is going to be longer, and the left renal artery is going to be shorter. You see the other branching of the aorta. This is the celiac trunk right here. Superior mesenteric artery is right there, and you'll also see some others. Left suprarenal vein, left renal artery we already discussed. Then the left testicular or ovarian vein that comes from here, and then you also see the inferior mesenteric artery over here. Now within this diagram, we'll also look at the relation of the kidneys with different organs. I've already discussed that when we look at the some superior overview, superficial overview in the previous slides. So you will also see here. So this right here is the suprarenal glands. This is right kidney. This red color is basically in relation with the liver. Then there is duodenum and descending colon right here. Sorry, the ascending colon right here, and this is the jejunum right there. So over here you'll see the spleen, the pancreas, and the descending colon right there. And this is going to be the jejunum in itself. And then this is a stomach right there and the suprarenal gland again. So we already discussed the surface relation in the previous slide right there. So now we are going to move on to the next segment, which is the segments of the kidneys. So each kidney is divided into 5 different segments. So these segments are superior segment, anterior superior segment, anterior inferior segment, posterior segment, inferior segment. So what is the importance of these segment? Each segment is supplied by the segmental arteries. So these are the end arteries with no anastomosis. So each renal artery is going to get itself divided into superior segment, anterior superior segment, anterior inferior segment, posterior segment, and inferior segments. So let's look at the diagrams again. So on the left side, you're looking at the kidney from the anterior aspect. On the right side, you're going to see the kidneys from the posterior aspect. So you see the superior segments on both of them: anterior superior segment, anterior inferior segment, inferior segments, and you also see the posterior segment right there. You also see the renal arteries, renal veins, and the ureters in this picture. So now we're going to focus on the external and internal features of both kidneys. So let's focus on the external feature. Both kidneys have the superior pole, inferior pole, a convex lateral surface, and the concave medial surface. And on the concave medial surface, you have a renal hilum. So this is present in the medial surface, and it marks the entrance to the space within the kidneys, also referred to as the renal sinus. So this is the external feature. You see the superior and inferior poles. You see the convex lateral structure and the concave medial surface. And this is the renal sinus or renal sinus that we just discussed. It has the arteries, it has the veins, it has the ureter, and the renal pelvis and the pyramids that actually converge everything here. So now we're going to see the internal features. In the internal features, there's 2 major portions of the kidneys: the renal cortex and the renal medulla. The extensions of the cortex between the renal pyramids is called the renal columns, and nephrons are usually present in these pyramids. So 2 or 3 minor calyces makes up a major calyx, and the 2 or more major calyx makes the renal pelvis. So let's look at the internal features again. So you see the cortex and the inner medulla right here. So these are the little extensions that are called the renal papillae. They make the minor calyces. 2 or 3 minor calyces made one major calyx, and 2 or 3 major calyces made the renal pelvis. So you look at the diagram right here. You see the major calyx, 2 or 3, making all of them making the renal pelvis, and that's how the ureter is actually getting originated from the kidneys, and it takes the urine down to the urinary bladder. So our next focus is going to be on the ureters, their constrictions, and the importance in the renal stones. So once the urine is created, it passes down the renal pelvis and onwards into the ureters. The ureters are retroperitoneal throughout their course on the either side. And there are 3 major constrictions on the ureters route. So one is at the junction of the ureters and the renal pelvis. The second one is when it is crossing over the pelvic brim at the bifurcation of the common iliac arteries into the external and internal portion. And finally, we have the entrance of the urinary bladder. So what is the importance of these constrictions? So when when the renal stone is passing down from the kidney, it can get lodged in either of these constriction, either at the junction of the ureter and renal pelvis, either at the pelvic brim, at the bifurcation of the arteries, from the common iliac arteries, or finally when it's about to enter into the bladder, there's also one constriction, so the renal stone can get lodged over there. So look at this diagram again. So you have kidneys both. This is left and this is the right kidney. You see the renal pelvis. So first constriction is somewhere here. The second constriction is going to be right here at the bifurcation of the common iliac artery, and the third one is going to be right here at the entrance of the bladder. So now we're going to look at the suprarenal glands. It is and its anatomy and the blood supply. So there's two glands that are sitting on top of each kidney at the superior medial aspects, and it is surrounded by the substantial amount of the perinephric fat, which actually supports it and separates it from both kidneys. And both of these glands are separated by the kidneys by a fibrous tissue. So external features, the external feature is that the right sided is triangular in shape, and it connects medially with the inferior vena cava and laterally in with the liver. And the left suprarenal or adrenal gland is semilunar in shape. It is related to the stomach, spleen, and the pancreas. The internal feature, it has two basic parts. So one is the cortex. The cortex is the outer part of the suprarenal gland, which releases corticosteroids and the androgens, and they're essential for the retention of salt and water. The second one is the medulla. The medulla is the part of the sympathetic nervous system. So it is very important that it produces the adrenaline, and it supports in the fight or flight response. We have discussed medulla in detail in the sympathetic nervous system, so I would urge to actually look into that video again. You see that the sympathetic nerve, it actually supplies directly the preganglionic nerve fiber from the sympathetic nervous system. It originates and it passes through the celiac ganglion, and it innervates directly the medulla of the adrenal glands. So what is the blood supply? The blood supply is the suprarenal gland have if is going to be very complex vasculature because of its endocrine functions. There are three major arteries which supplies both glands, and these arteries are originating directly from different arteries. So it's going to be superior, middle, and inferior. Then you're going to go to the name: superior suprarenal artery, middle suprarenal artery, and the inferior suprarenal artery. So the superior suprarenal artery on both sides, it originates from the inferior phrenic artery. The middle suprarenal artery, it originates from aorta directly, and the inferior suprarenal artery originates from the renal arteries from either side. And then these branches off into 50 to 60 smaller arteries, and it supply very extensively throughout the adrenal glands or the suprarenal glands. The venous drainage is going to be the right suprarenal vein and the left suprarenal vein, and it drains directly into the consecutive vein. So right suprarenal vein, it drains directly into the inferior vena cava, and the left suprarenal vein, it drains directly into the left renal vein. So you look at the diagrams right here. Once again, the placement of the inferior vena cava in front of the aorta is very important in this. So you see this aorta is giving branches to the inferior phrenic artery, and from the inferior phrenic artery you see the superior suprarenal arteries. The middle suprarenal arteries, they get originated directly from the aorta in itself, and the inferior suprarenal artery is getting originated from the renal artery. So this is the abdominal aorta, renal artery originating, and the inferior suprarenal artery, and it happens on both sides. But when you look at the venous drainage, you see the right kidney and the left kidney, the left renal vein and the right renal vein. If you remember, the right renal vein is smaller, so the drainage of the right suprarenal vein is directly into the inferior vena cava. However, you see that the left renal vein is actually longer, so the left suprarenal vein, it drains directly into the left renal vein, and that gets drained into the inferior vena cava. With this slide, we are going to end our presentation. Thank you so much for supporting, and please subscribe to my channel, and I'll see you soon with the other lectures as well. Thank you and have a great day.